This panel is health sector to engage maternal and child health, different experience from Central and South America. Different organization present different experience working with the health sector in Brazil, Chile, Guatemala, and Nicaragua. This panel is present in English, Spanish, and Portuguese. And Mary Robin is our friend from Promundo, Brazil. She helped for translation in English. Okay? Okay. The first presentation is from Maria Eugenia Villarreal. She's from Guatemala. She's a director for this organization working in prevention and trafficking sexual commercial. She's a sociology. She's an activist. She has many years working in this organization. And in this moment, she presents the experience working in the health sector in Guatemala. Welcome, Maria Eugenia.
Okay. Good afternoon. I am going to present you our experience in applying a project for fatherhood and caregiving. The strategy that we are having is how to involve men and women in the pre and post controls during the childbirth in order to strengthen the ties between fathers and their children. So this project is supported by Men Engage Promundo and is implemented in several countries of the world. And now I want to share this experience in Guatemala. My colleagues are going to present the project, their experience with this project implemented in different countries in Latin America. So the first, okay. Yes, of course, no? Okay, so we believe and we think that through this project we can strengthen gender equality, prevent and reduce violence against women, maltreatment, and sexual abuse of children. Also, we believe that it strengthens the psycho-emotional ties of the fathers with their children and family, and thus reduce domestic violence. We also believe that benefits women from having a caring partner who supports them during pregnancy and child raising. Also believes that this project reduces maternal stress associated with the pregnancy when both parents are equally involved during pregnancy. And for the last, it strengthens couples and family relationships. The division of labor, of homework, and caregiving to their children. So we are looking to have these results. We are looking to have this impact with our target group, that they are young men that are going to be fathers or they are already fathers. Okay, so the next one, please. The objective that we have in this project is to contribute to a paradigm change regarding the gender relations and the roles socially built in the care of children, relations among couples, and housework. So the goal is a huge goal that we are looking for, because it's to change a paradigm that exists during centuries, but we have to give steps on this issue. So this project, and I appreciate this methodology, this project, because it's creative, innovative, it's a new model, is another way to focus these kind of projects. We have been, well, in the 80s and 90s or 70s, we saw the projects for the supported by the feminist movements, that they were quite different. Now we think that through the involvement, through the health sector, we are going to have results. So, no, this is our main framework in which all of us, we are working for in different countries. Okay, now the context, why Guatemala, and what is the context in Guatemala? Next. Okay, we are talking about Guatemala, well, a Central American country that has bordered with Mexico, Honduras, and El Salvador. It has a patriarchal society and discriminatory towards men and children. This is important. It has high rates of gender and domestic violence, one of the highest in the Americas, and I will be back with this issue. Men see themselves only as financial providers. Fathers are not involved in the pre- and postnatal care of their partners, much less attend the birth, and fathers establish domination and control relationships with family members. That is why this is patriarchal. And what about this issue? Because it's another challenge that we have. Guatemala is a post-conflict society. Guatemala lives 36 years of armed conflict. In 1997, they achieved the negotiations of a peace agreement, and everyone thought that with the peace agreement, the violence was over. The bloodshed was over, but it was not true. The armed conflict was transformed to the armed violence that we are living today. Guatemala, El Salvador, and Honduras are the countries with the highest rates in the world of armed violence, of homicides. We are talking about, for example, in Guatemala, 45 homicides per 100,000 people. It's so high. And the highest rate in this context, and this is so important, because the social violence is reproduced at home. One issue. The second issue is that the insanity of the civil society. The civil society, in one way or in another, is insane, because there are many years that they have suffered of armed violence. Okay, this is the context. So, what is the strategy that we are going to develop in this scenario? Are we going to have results in this scenario when the violence outdoors are increasing and increasing all the time? So we said, well, we must look for innovative methodologies, creative methodologies, in order to see if we can change the chip, or we can give a step forward in decrease the violence. Strengthen the respect between partners, and also respect children. We are a human rights organization. Our driver is children's rights. So with this driver, with this focus, we are approaching this project. So this project has several programs. We want to give this project a holistic approach, a human rights approach. So we are implementing programs address for training and awareness of the health providers in health sector. We are working with the private health clinics and hospitals. These clinics and hospitals are supported by IPPF. So it's addressed for low class and with a social perspective. So we based this project on this institution. So we have this kind of programs, training programs, awareness programs. Address to these is the health providers. Which are these health providers in the clinics? Okay, gynecologists, pediatricians, psychologists, and we are training all of them. First of all, to give them information, to change their minds, in order that they can invite the partners of the women they are attended. And of course, we want, they say, well, in one moment we want the couple of you coming for the controls. That's why we are working with them. Second, we must involve the staff of the institution. Okay, we are training the administrators, staff, and all people, nurses, also the social workers around this project. Third step, we are training educators and promoters in order that they can train fathers, and we have reached 600 fathers. Okay, this is one aspect of the project. But the next, second challenge that we have, say, well, we are going to make an ambience and environment friendly for men that are coming. What we have to do? Well, we need banners, we need posters, we need information, inviting fathers, no, that they are and saying, you are very, very welcome. We need you. We really need you. Come with us. They say, well, we have create this friendly environments. Okay. Third program that we have produced a lot of material to be spread out with the fathers, and also we are establishing bridges with other networks in order to strengthen the project. But finally, we say, well, who are the fathers? Where we can meet fathers, young fathers? Okay, I think that one target group that need this kind of message, they are the soldiers, there's the army, they are the policemen. So we establish contact with the army in order that they can open their doors, that we can go there to train the soldiers, young fathers, soldiers. Okay, so this is the program that we have developing. We are finishing the project, but I think that we have results. And we can consider this project as a best practice because we have results. And you know what is the best results? That we have institutionalized the project in the health sector. How? Changing policies, institutional policies. How? With School for Fathers, for example, no? How? That the institution respects the rights, the father's rights to have 3 or 5 days free when they are having a child. 4, because the hospitals must be open to men. That's the issue. Okay, we got it, and we are very proud of this because we consider that this is very important. So at the end, we have this kind of policy. We have, this is friendly spaces. We have a school for dads, because it's so important, because we left the ideas, we left there the methodology that how we can involve fathers, the new fathers, and also we have multiple providers, a critical mass created, trained in the institution. So I think that with this critical mass, we hope that the sustainability of the project is done. Okay, challenges. Okay, I have 3 minutes more. We have a lot of challenges because, well, now it sounds great, but we have a lot of challenges. No? First of all, that we are implementing the project just in Guatemala City, no? And we have to go to another areas. We have to go to work with the indigenous population. This is the most part of the population in Guatemala. The 60% of the populations are Mayas, are indigenous population. So we have to involve them, first of all, no? So we have to involve midwives, for example. We have to create more innovative programs, men reproductive health, for example. To link more programs directed to strength caregiving, but in a creative way. So we have these challenges. We hope to continue working with this because we believe that we can change the paradigm, that we can give a step on this sense that we need it. Thank you so much.
Thank you, Maria Eugenia. Okay, in this moment it's possible to 3 questions, a comment for the presentation. Or in the end? Okay. Okay, at the end. Okay, al final. Okay, okay. Thank you. Okay.
Yo diría porque es muy diferente el contexto que ustedes por la guerra.
Okay. Bueno.
Okay.
Okay, at the end, the presentation. Okay. The second panelist is Marco Aurelio Martinez. Marco Aurelio Martinez from Brazil is an executive coordinator Promundo Brazil, coordinator of Men Care Campaign Brazil, coordinator Action Relaxed Involvement and Caregiving in Promundo, focal point on Men Engaged and Men Care Brazil.
Thank you, Douglas, for the introduction. Good afternoon, everyone. Good afternoon, everyone. How are you doing? So exciting week. Many things interesting to see, right? So thank you for being here. Thank you for having me here. So I'm going to take advantage of having in the room Mary, who speaks perfectly Portuguese. So I'm going to present in Portuguese, so you are going to have the opportunity to listen the beautiful Portuguese. Okay? Bom, meu trabalho é sobre a colaboração com o setor de saúde para envolver homens com saúde materna e infantil. O Promundo tem trabalhado já há 12 anos, tem feito parte de uma rede, que é uma rede chamada Comitê Vida, que é um grupo de trabalho, né, formado por instituições do terceiro setor, da universidade, é coordenado pela Secretaria de Saúde do município do Rio de Janeiro. A ideia aqui hoje é falar de uma experiência prática, né, que a gente tem tido uma série de ações em conjunto, mas eu gostaria de highlight a experiência das unidades parceiras do PAI.
Promundo, the NGO based in Rio de Janeiro, Brazil, has been working 12 years with the Secretariat of Health in the state of Rio de Janeiro And Marco is going to talk about this collaboration and and also with Comitê da Vida. Comitê Vida, which
Life Committee.
a life committee. Is that through the government?
Yeah.
Okay, through the government. Sorry, I'm going to catch up on this. But and he's going to talk about Promundo's collaboration over the last 12 years and most recently with this project.
Eu selecionei essa experiência para trazer aqui para vocês porque me parece um modelo de participação igualitária, né, de universidades, de pesquisadores, enfim, com a ideia de transformar políticas públicas para envolver homens na saúde materna e infantil e para envolver o tema da paternidade nessas políticas. Vou falar por aqui.
He just mentioned this is a participatory model that it's important to remember that this is something worked on with universities, local universities, with local NGOs, and at various levels of institutions in the state of Rio de Janeiro, and with the goal of transforming public policies.
Bom, queria também antes... Esse está melhor? Aqui para frente? Aqui, pessoal, quer me ver? Bom, queria trazer um pouco uma visão geral, né, de onde eu estou falando, né, que eu trabalho no Promundo há 3 anos, é uma organização que tem escritório no Rio de Janeiro, mas tem escritório nos Estados Unidos, um em Portugal e a gente recentemente abriu um em Ruanda, em Kigali. A missão é promover masculinidades não violentas e relações de gênero equitativas. A gente trabalha, na verdade, eu não vou apresentar um fluxo de trabalho, mas uma ideia geral daquilo que a gente faz, que é produzir diagnóstico e produzir pesquisas para trazer mais dados sobre masculinidades para a discussão. A partir desses resultados, a gente desenvolve metodologias, também intervenções, né? E entendeu ao longo desse processo que campanhas junto com intervenções têm tido resultados mais efetivos, né, em direção a buscar esse maior envolvimento dos homens com saúde materna e infantil. Os projetos e as intervenções têm monitoramento e avaliação, e isso...
Let me catch up.
It is in...
Oh, okay, you don't want me to say exactly what you're...
Okay. Isso estrutura a nossa ação de advocacy para promover novas políticas, enfim, e transformar leis nessa, e também isso orienta o nosso trabalho para levar, como nós temos uma limitação de atuação, o trabalho em parceria com o Estado tem permitido a gente ampliar essas intervenções e esses projetos menores que a gente vem implementando em conjunto.
A lot of this is summed up over here, but he's just talking about how Promundo, it was originally based in Brazil, and since then we've opened up offices in Rwanda, Washington, in Portugal, and the methodology goes as researching about masculinities and creating formative research for projects, and thereafter creating methodologies, and then taking these methodologies and creating community campaigns, which is considered a big part of our work. And with the entire goal of working with the state of Rio de Janeiro, taking these small situations, small case studies and projects, and carrying it up to the state level to reach more beneficiaries, specifically now with this project with maternal and child health.
Bom, aqui eu selecionei alguns dados, algumas informações, na verdade, que baseiam um pouco do nosso trabalho, né? E que também nos orientam a realizar a nossa ação no campo. O primeiro dado que vem do estudo Images, 78% dos homens reportaram ter... 76%, isso. Reportaram ter estado em pelo menos uma visita de pré-natal. Isso nos ajuda, né, esse dado nos orienta a fazer um trabalho desde o início, ou seja, investir no pré-natal como espaço prioritário, uma porta de entrada para o trabalho de envolvimento dos homens. O segundo ponto é um dado Prefeitura do Rio, que foi uma pesquisa realizada durante uma campanha de vacinação. 84% dos bebês de 0 a 6 meses tinham contato diário com seus pais.
Just elaborating on the first 2 points and the percentages, and talking about the importance of 76% of men going to the first prenatal consult, seeing that as an entry point to identify men and mobilize men through the health sector.
Okay. Bom, o terceiro ponto tem a ver com violência que acontece no lar, e também o número alto da violência acontece durante a gravidez. Esses dados são da Universidade de São Paulo. Uma outra informação, aí na verdade não é um dado, é que no Brasil o sistema de saúde, embora a gente tenha aqui a presença do nosso coordenador, né, da área técnica de saúde do homem, Eduardo Chacora, a gente tem feito muitos esforços para ampliar, né, essa participação do homem no sistema, né, e também no autocuidado, mas o sistema ainda é focado em saúde materna e infantil. Esse é um dos grandes desafios que a gente vem enfrentando.
One of the biggest barriers, challenges that they've experienced with this project is how to engage men in maternal and child health in the health sector. And he just said our partners here from the Ministry of Health, Eduardo Chacora and Danielle, who we work with closely on these things.
E o último dado as mulheres fazem parte hoje em dia, né, elas representam 40% da força de trabalho. Né? Houve um movimento, como a gente sabe, ao longo das últimas décadas, mas a gente não percebeu esse mesmo movimento por parte dos homens. Né? Então, a gente entende também que o trabalho realizado nas unidades de saúde é importante também para a gente promover relações mais igualitárias, né, onde os homens também possam dividir as tarefas de cuidado no lar e as tarefas domésticas.
Through the research and work, we've seen the importance of working with healthcare units and how that can create more equitable households, and looking at the increase of women in the labor market in Brazil and how the division of household chores has not necessarily changed as more women are entering the labor market and working more.
Bom, o que a gente vem fazendo em conjunto agora é o lançamento. A gente lançou uma campanha de paternidade cuidada, a campanha Men Care Global, foi adaptada localmente em parceria com as unidades de saúde no Rio de Janeiro. Aqui vocês podem ver por esse pôster. É um casal de uma das comunidades onde a gente realizou grupos educativos, mobilizando as unidades de saúde para que envolvam os homens nos serviços.
So Promundo is working really closely with the public healthcare units, launching this national campaign, Você é meu pai, You are my father, and that's through the global Men Care Fatherhood campaign.
Isso. A gente também, em parceria com os nossos colegas da América Latina, Chile, Cultura Salud, Nicarágua, Redmas, nós construímos um manual, que é um manual para o exercício da paternidade ativa, né, e participativa, que é o programa P, e nós temos adaptado, né, nós adaptamos a versão que foi construída em espanhol para a versão portuguesa, em conjunto com os profissionais da área de saúde. A gente levou até mais tempo para ter essa versão final, porque a gente gostaria, né, a gente fez questão de envolver os profissionais da área de saúde na elaboração dessa versão brasileira, porque a gente entendeu que essa era uma forma de garantir a utilização desse material, e não durante a duração do programa.
Together with all the partners here from Chile, Nicaragua, Program P, the Fatherhood Manual, standing for Paternidade, Fatherhood, was developed in Spanish first and then brought to Brazil and adapted and translated. And the most important part in this sense was that it was done with the healthcare workers, and they offered input throughout the elaboration, and this was done in order to guarantee the sustainability of the actions with the healthcare units.
Bom, como eu mencionei no início, esse trabalho que vem sendo feito nesse grupo, que é o Comitê Vida, nós, junto, né, nesse processo, elaboramos alguns critérios para estimular algumas dessas unidades se tornarem unidades parceiras do pai, né, que é o projeto que eu queria apresentar agora. A ideia é transformar, né, essas unidades em parceiras, e é um programa de certificação, ou seja, baseado em algumas sugestões, em algumas recomendações que são feitas para que essas unidades se tornem parceiras. Pode passar o próximo.
Just that this was done to stimulate partnerships with the healthcare units, and through that, a certification that they would receive through working on this project, specifically with Comitê Vida.
Yeah, exactly.
Okay.
Bom, esse programa é baseado em 10 passos, né, de como se tornar uma unidade parceira do pai. Como eu falei, existe uma recomendação anterior, né? A gente vai ver por alguns desses passos o trabalho que nós, como sociedade civil, podemos desempenhar, e nós entendemos que existem diferenças, né, daquilo que é papel do Estado, daquilo que é papel do terceiro setor. Treinar os profissionais envolvidos no serviço de saúde, incluir os pais em consultas e exames de saúde, incluir os pais no pré-natal, no nascimento e no pós-natal, incluir os pais nas enfermarias